This episode is brought to you by Indeed. When your computer breaks, you don't wait for it to magically start working again. You fix the problem. So why wait to hire the people your company desperately needs? Use Indeed's sponsored jobs to hire top talent fast. And even better, you only pay for results. There's no need to wait. Speed up your hiring with a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Take your plans out of the group chat and get long weekend ready in new Abercrombie. From day to night, pack new outfits for every part of your itinerary. Grabbing brunch? Throw on the A&F Mila dress. Then head to your dinner reservation in their new bubble hem mini dress. And yes, permission to overpack for pics with the girls. Abercrombie's best-selling Scarlet Squirt deserves a post in your feed. Your plans are worth it. Shop Abercrombie's new long weekend collection online or in store.
The Dental Download podcast is your source for insight from conversations with fellow dentists, specialists, and leaders in the industry. With new episodes every Monday morning, I'm your host, Dr. Haley. Let's get into this week's episode. Okay, hello everyone. We have another wonderful guest here today. Dr. Nikita, could you introduce yourself and tell us about your background and now where you're at in your dental journey?
Yeah. Hi, everyone. First of all, thank you, Haley, for having me. My name is Nikita. I completed my dental Doctor of Dental Surgery from the University of Michigan, Ann Arbor. Me and Haley were classmates. That's how we connected. But currently I'm working. I've started working. It's been, close to, I would say, 7 months. I'm originally from India. I did my first dental degree back there at Manipal, worked for a couple of years and then got to the US, completed my second dental degree. And yeah, here I am. I'll be happy to share my experience with all of you.
Awesome. That's good little tidbits that we can dive into one little piece at a time of your journey and how your experience is going now. But first, we'll kind of start towards the beginning. So what was your training like in India and then that process of deciding I want to go to the United States?
Right. So my Indian dental program was 5 years, 4 years of just plain, academics and clinics. And the final year, which was the 5th year, was all about just clinical. So when I was in my 3rd year, I got to know about an exchange program that my school was kind of tying up with in the US with the University of Iowa. So I got selected for that program, went during my 5th year for 10 weeks to travel to the University of Iowa, where I was an exchange student. So did a lot of work at the dental clinics there. That was my first kind of experience seeing dentistry in the United States. When I was there, I kind of explored a little bit more, completed my exams and, pre-requirements and was almost ready to go apply to schools in the US once I graduated.
Gotcha. So that made you decide that I liked the United States and that was something you wanted to relocate for.
Correct. So that was the dentistry part of it that, I really wanted to, I saw what the United States had to offer, just saw a lot of opportunity there, a lot of, scope for learning. Apart from that, I had been to the US a few times to visit family in the past. So I always kind of liked, everything here. So a little bit of that also had an influence for sure.
And did you find through your program in India, maybe from other colleagues, or did you have to do all of the research yourself on figuring out what it would be like to apply to a U.S. dental school?
Yeah, so a lot of my seniors are, people who graduated from my school before me. So they went through this process and I was in touch with a few of them. So they definitely kind of helped. But apart from that, there are resources online that you can, refer to. You get to, understand the whole process. When I was applying, I feel like the resources were a little scattered. So I had to kind of do my research almost like every day kind of find out the best things. And there were a lot of companies that were helping out in terms of, mentoring you how to go about it too. So just a lot of information. But at the end, I feel like it was a very traditional, very, very classic process of applying, which was submitting an application to the school. After that, you get invited for an interview, a clinical exam. And if you clear all of those steps, you get into dental school in the US.
So I know probably when you were applying, it was after like the COVID pandemic and everything. So did that affect, were all of your interviews virtual, or even before COVID, did they do the international dentist program traditionally virtual interviews to save on traveling, or how did that work?
Yeah, no. So it was all in person. So the national board exams, which all of us gave during dental school. So the theory part of it, we were supposed to give before we even joined dental school or applied to dental school in the U.S. So to give those exams, we had to travel to the U.S. So that was the first step. For all the clinical exams, yes, it was all in person, where you would have to, you know. Give the exam on mannequins, and it was pretty much the basic restorative pros, things like that. But during COVID, for Michigan, for me at least, I had a virtual exam because it was right around that time. But I've also, for another university, I've given like a proper in-person bench exam as well.
Interesting. Okay. So, yeah, I mean, in addition to being a competitive, like time consuming process, it also sounds like it would be very expensive to try to get to go to these programs, let alone you don't even know if you're going to get in. So, that seems very stressful.
Yeah, no, for sure. I still remember I graduated from dental school in India in 2018. I was working two jobs, like from the morning till the evening, just trying to, get all the funds I could for the application, especially being in another country when you have to apply to schools, you have to submit like everything. It's just so much money. So yeah, those 3 years that I was in India, I was pretty much working two jobs, sometimes picking up like part times here and there, just to kind of have that fund to be able to pay for applications, and like the travel if needed for the interviews.
So, what's some other advice you have for people that are going to be applying as internationally trained dentists?
Yeah, so I think the cycle's actually starting pretty soon in, I think, late March. But the process to apply is through a centralized application process. It's called CAPID. You submit your application there. It goes to a lot of schools that you select, and then after that, you hear from them, and it kind of goes from there. My advice would be apply early. That would be the number one advice, since it's a very competitive process. A lot of international applicants are applying, so it would be best to just submit your application as soon as possible. Number two would be as um, apply to as many schools as you can. So I know it sounds hard because there's so much work you have to put in for individual schools, all these supplemental essays and things like that, but it's worth it. You don't want to decrease your chances by applying to fewer schools, because it's a whole cycle. That's a 1 year cycle. So if you miss out, you have to go on to the next one, and you pretty much lose a year. Third advice would be try to stand out. There are so many students applying from every country. What I've understood during my process is that schools like to have diversity in the class that they kind of make. So let's say if a dental school in the U.S. is accepting 20 students, like they did in Michigan, they kind of try to have a diverse class in terms of international students from different countries, bringing in different experiences, different cultures. So if the country you're applying for has a lot of applicants, you need to stand out even further. I would say apart from that, I would say these are my three main ones. And the last one would obviously be very, very, very resilient, and don't give up. Like, I know people who've gotten in the first cycle, but then I also know people who've not gotten in till like their fifth cycle. So what I know is that everybody gets in. Everybody, you are gonna get into school. It's just gonna take time for some people. For others, it won't. So just don't lose hope. Don't lose focus.
The last thing you want to hear when you need your auto insurance most is a robot with countless irrelevant menu options. Which is why with USAA Auto Insurance, you'll get great service that is easy and reliable, all at the touch of a button. Get a quote today. Restrictions apply.
Every cup of Nespresso coffee is an invitation to transform your morning routine into a ritual you can treasure each and every day. Using the Virtuo Pup, a simple touch of the button freshly brews bold aromas and a rich, velvety crema layer for delicious cafe-quality coffee at home. Whether you enjoy your coffee hot or over ice, every sip, every morning is unforgettable. Nothing tastes like Nespresso coffee. Visit Nespresso.com or our app to explore our full range of easy-to-use machines and coffees not found anywhere else.
And if someone was reapplying, I'm curious, how long would the clinical, like, national boards be good for? How many cycles could they go without needing to retest?
I think it's you just have to take it once, so it never expires for you. I know that there are some schools that require you to take another exam. It's called the ADAT. I forgot what the full form is, but then it's another exam that some schools require you to take if the national boards that you took, if it's been like 5 years or more. I know the University of Las Vegas, I think Nevada does that. If it's been more than 5 years, you need to take the ADAT for you just to kind of put your credentials back in there.
And was there anything else you kind of wish you knew about the application process, or anything that would have been nice to hear as you were going through it yourself?
I would say when I was applying, I did not know that it's going to be so competitive. So that was definitely a big shock. I thought that, it's going to be, I'm already done with dental school. This is going to be fine. But it's just, I just feel like it's so much you have to put into. I did not have a lot of US experience when I first applied. So I would advise everyone going for this. Whenever you go to the US to give your exams, make sure you find an office where you can shadow, or if you can assist, anything you can get to show the admissions committee that you are interested, you're really motivated to learn about how things work here, and then you're going to be fully integrated into a program like that. That would really help. And then also when you do end up doing that in the US, you end up, meeting other dentists who are here, and they can give you some letters of recommendations and things like that. So that makes a huge difference. I think I found out about that a little later.
Interesting. I wouldn't have even kind of thought of that, but it's just everything you're saying. I'm like, wow, that's just that much more difficult than if you are like a United States student applying the more traditional pathway. Like, you already live here. It's like a lot easier to get the resources that you need to boost your application compared to having to travel and like stack all of your experiences together when you're there. And it seems like a lot. So kudos to you and to everyone that goes through that process. But I'm sure you feel now, like, that you're through it, that it was well worth it, but it seems like it was a lot.
Yeah, no, absolutely worth it. I would say anybody who's even thinking about this, you are making the right decision. It is going to be a hard path, but you're going to make the most out of it. When you get into school, you'll learn a lot. And then when you get out of school, you're going to be working. You're just going to make up for all the time that you put in, all the money you put in. Everything's going to, come right back. Yeah.
That's awesome. So as you mentioned, we were classmates at Michigan. So what was your experience like in choosing Michigan? And I know you'd never lived in the cold before, all those more fun, silly things we've talked about, but overall at the program, anything you want to share?
Yeah, no, I loved Michigan. I did apply to a lot of schools. I know I got into the University of Colorado. That was somewhere I was just gonna go, and then Michigan came through. I think being in another country, you know things like, you know, the ranking, that's what's available online. You get to speak to a few students. So one of my seniors actually graduated from Michigan, so I was in touch with her. She loved the program too. So yeah, I just decided to go for it. And yeah, once I came in, I loved how we, you know, it was, even though it was an international student batch, we were 20 of us, but then we were pretty much well integrated with the other students, with all of you. And that was really cool because then we just, you know, it was like learning so much more together, versus a lot of other schools I know don't do this. They keep the international students separate, and because they just feel like they have another you know, skill set, and they kind of go have another curriculum for them, and that's so they are not able to fully integrate with the other students in class. So I kind of really liked that about Michigan, for sure.
When did acceptances kind of start going out if you would be applying at the end of March? And then I know our program started in January, like a year. Is it like a year-long process plus some months, I guess? And then when did you end up moving to the US for the January start of the program?
Right. So I moved in December, but I think we heard back from the admissions committee probably late July, early August. And then after that, you know, getting all your paperwork for the visa, you know, getting all of that kind of set up takes a little time. It actually takes, you know, a lot of time getting all of those things set up. And then I moved here, December, started in January. So roughly around, you know, nine months. Yeah.
How was that moving to a brand new place that you've never lived before and then pretty much jumping right into, I mean, from what you've all told me, like the first bit of the dental school was so rigorous because they're putting so much academics on top of you in addition to doing like all the other classes that the rest of the D3s were doing. It was very intense, and being in a new place too.
Yeah, I think yeah, the first semester was hard with all the exams and everything, and especially when you're you know, especially something that you have to go back to, like basic sciences or pharmacology and things like that. So to be honest, I didn't love the exams. I that was definitely a little bit of a tough, you know, part. But then once that first semester was over and we started doing clinicals more, I loved that part. I think that, and I feel that's the same with all the other international students too. We all really enjoy the clinical aspect so much more because it just seems like, you know, that's where we want to just grow and learn. And there's so much to learn, so much about insurance, which was not there back in our home countries, and just kind of getting acquainted to the patient population here, how to talk to patients, how to, you know, what's important, the material, digital dentistry, so much to learn.
How was it coming into being a student again after you'd been recognized as a dentist and working as a dentist, and then now you're back kind of in the student ranking and position?
Yeah, I feel like I personally love to learn. So I'm like a lifelong learner. So I love being a student. I love being, you know, back in that position where I can look up to someone, learn from them. So it wasn't very hard for me. I was taking it day by day, you know, just learning about the materials, like I said, technology, things like that. Obviously, Michigan did recognize a little bit of you know, being, you know, an international dentist and things like that. But yeah, I think it's very important for anyone who is thinking about something like this, that you have to be a lifelong learner, because once you enter school, you will be a student along with everyone else. So it's not going to be different, you know, for you. So yeah.
And you mentioned some of like the differences that you were trying to pick up on with the training, like materials and technology. Would you say a lot of what you were trained on at Michigan was quite different than what you had been trained on in India, or it was just a little bit more modern and things because it was a few years later?
I would say the basic dentistry remains the same. So, for example, you're doing a composite. So, how much do you edge? How much do you bond? All of that remains the same. But the I would say the digital dentistry part, like I'd never scanned a crown prep, so that was new for me. Then I know our school had started a little bit of milling the crowns and things like that. So that was a little new. I would say um, prosthodontics was a little different. We back home had done a lot of flippers, but over here we were doing a lot more cast partials, things like that. The biggest difference, which I loved, was the comprehensive dentistry part of it. So all our patients that we saw for the first time, we were we were diagnosing, treatment planning pretty comprehensively, and then they were our patients, right? So we would see them from the start to the end. Obviously, we would refer them to specialty clinics if needed. But in India, we were more, kind of rotating department wise. So let's say you're in the endo clinic, so you just do endo. You're in the extraction clinic, you just do that. You're in the restorative, you just do that. I think both have their pros and cons. When we used to do that, I knew that I was getting better at one procedure, like kind of building my skill set there. In the US, I thought it was more just being able to think in a way where what you would do in private practice, just kind of take care of the patient and build that relationship. I just feel like it was a little more rewarding because you would see that patient more than once.
Yeah, those are all really good kind of compare and contrasting features. And something else we were talking about earlier is the way that Michigan did the ITDP program was that you integrated into a pre-existing class, which has kind of its pros and cons. So what advice would you have someone that's maybe nervous about joining into a group of people that already kind of all know each other? And then also, I mean, you have your ITDP cohort to kind of lean on that's going through the same thing, but what advice would you have?
Yeah, I would say obviously it's not easy to move to another country. I would say believe in yourself. You're there for a reason. You got into a school, you got into a program, you were selected. So believe that you're bringing in something, right? So you're bringing in a little bit of your skills, you're bringing in your culture. So yeah, I just thought that, at Michigan during my experience, everybody was super welcoming. I never felt like an outsider or anything like that, so it was all pretty nice. And I feel like that's what, most of the schools. So you just have to go with the flow, and yeah, it all works out.
I love that. I mean, and people are probably can tell from listening to you that you're a very kind and positive person. And I think going into something like this with that kind of energy is really important to kind of make the most out of situations and look at them with the right mindset too. So they can take your advice, hopefully, and have a good experience as well. Before we kind of keep moving here, I do want to talk about where you are now. So we went through dental school, you enjoyed it, and now you're working. So what was the process like for looking for a job for you?
Yeah, so once you graduate, the portals that you find the job are pretty much the same. So it's LinkedIn, Indeed. You hear from other people about where jobs are available. There are some lunch and learns we had at school. A little bit of a difference in the process for an international student might be the visa part of it. So when you are on a visa, you need to find someone who would sponsor a work visa for you. So in my case, I thought that a lot of DSOs were willing to do that. They needed more people. They were well versed with how to do it because they had done it for others. I did find a few private offices that were also willing to. They were, so I would interview and they were like, we like you and we can do this for you, but we haven't really done it for anyone else. So that would scare me a little bit, to be honest, because if it's a very important process for us. So if it kind of messes up a little bit, you might have to just leave or something like that. So if someone's not done it, I would just tell everyone to be a little cautious that even though that you love that job, you might have to think a little bit about how well the visa process is going to work for you. I just feel like if someone's done it more times, there's less chances of things going wrong.
Gotcha. And from when we graduated in May, was there what was the timeline from when you could start working? Was that dependent on the work visa, or was that just the start date that you had selected?
Yeah, it depended on the visa a little bit. So we did have to wait for our license, but then we also had to wait for our work permit. So that did delay the start date a little bit. So for example, I don't think I started till August. Yeah, so yeah, I think it's a little different for everyone. So you get a little choice on what you want to put as your start date, even during the visa application process. But it also depends on when you finally get that permit. So I would say it depends.
Okay. And was that was fine having kind of that grace period from graduation up until you started working? There were no issues there?
Correct. Yeah. There's a limit on that too. I think it's around 90 days. But then yeah, you're okay to be here. Yeah, I remember I just traveled a lot.
Yeah, that's awesome. Yeah, I know we didn't talk about too much about you personally, but that's one of your big traits is you love traveling with your husband and everything. You've done so many cool trips. I love always seeing what you guys are up to. So I'm also curious with your particular job search, what were some things that were important to you when you were looking at offices? What were some things you were comparing? What were you kind of seeking out for this first opportunity?
Yeah, so I would say for me, I was like, this is gonna be the next 2 or 3 years are gonna be my hustle period. So I was ready to work. I was ready to work 6 days if needed. I was ready to work long hours. I just wanted to get the most out of working. So I was trying to look for offices where I would see a lot of patients. I would have a lot of work to do. They would keep me busy. So those were important for me. I did have a few skills that I had as goals that I wanted to accomplish. So one of them is implants. I know I'm going for my implant training soon, but yeah, pretty much just getting to do a lot of hands-on so that I get comfortable with definitely the bread and butter dentistry, but also grow a few skills. One of them was definitely implants. The other one was a little bit of maybe Invisalign. I still have to kind of delve into that, but yeah, these two for now.
Awesome. So tell us a little bit more. What is your current office like? What's your role there and how are you liking it?
Yeah, so I'm working at one of the DSOs. My role is a lead dentist there. So what that means is that I am the only dentist in the office that is there every day, morning till evening. There are some other dentists who come on a few other days, maybe 3 or 4 days in a month. So they're the second doctor, but otherwise I'm there as the main doctor. I have three assistants that work with me, one office manager, a front desk staff, and then yeah, that's pretty much my office team. Um, I would say so it's been an interesting experience. Have not done a role similar to this in the past, so it's a lot of responsibility. When you just start out, but it's been great in a way that I feel like I'm gaining a lot of confidence. I'm learning to make decisions, especially like clinical decisions on my own. Also learning how to manage a team and just like communication within the office and with your teammates and all of that.
So, I mean, we're really approaching almost a year of working. It's crazy. Have you had any of those kind of tougher moments of being the lead dentist in terms of any firings or disciplinary action, or does the office manager more so handle that?
I would say a little bit. The office manager does that a little bit more than I would do it. She's also been at the office for a lot more years. So yeah, I kind of leave that on her. But yeah, I feel like I am asked. My opinions are valued. And yeah, I feel like that's been a little bit of a challenge for me for sure. I feel the clinical part is okay. It just works out. Like I have gotten stuck with extractions. I've been there for 2 hours trying to take a tooth out, but then finally did. But more so about managing the team, giving feedback. I've been learning all of that, and I feel like that's a skill to develop eventually for sure.
Yeah, I mean, that's such an amazing experience. As much as all of the moments might be challenging, I mean, you're learning so much on all the different levels. I'm also curious, so with that, do you feel like one of the things people seem to say that they really like about DSOs is they get a lot of CE support and they have kind of the community with the other doctors, even if they're at another office. In your particular case, would you say that stuff reigns true, or is there anything else you particularly like about working for a DSO?
Yeah, I would say there is a lot of clinical CE support for sure. I agree with that 100%. Apart from that, what I like about the DSO is that they have a very well managed team where it's their responsibility to bring you new patients. It's them marketing, advertising. So you're never worried about not having enough patients to see. And that's, I think, the best part about this because I'm always busy. And, I like that personally because I feel like it's good for me. I feel like I'm seeing more patients, so making more difference in, the community overall. Um, Apart from that, I do in my role, I like, just having that independence, but also having that mentorship. So in my office, even though I'm the lead dentist, there is another owner who is another dentist and he owns multiple practices. So I know that I can always kind of call him if if I need help, if I want a suggestion, something like that. But yeah, yeah.
And another thing we've talked about is that you were looking for kind of the best job for you and you were willing that you commute fairly far and you work long hours like you were saying. So is that something that, you're glad that you're doing? You mentioned you were going into this time period like knowing you wanted to work hard. So would you recommend that to people as long as they kind of know what they're getting themselves into?
Yeah, I don't think it was a bad decision. It does make my day go faster, but I am Monday through Thursdays. I'm super tired once I come back. So definitely that's gonna become your life at least for 4 days of the week. Fridays I work half days, so I come back home earlier. But yeah, I feel like it's been worth if you enjoy doing something. I think it all works out. Obviously, not every day is the best. There are some days when you're super drained. You feel a little burnout, but overall, just having the long term goal that kind of makes you going.
And for everyone listening, Dr. Nikita is recording this on a Friday afternoon when she just worked a super long week. So shout out to you and thank you for giving us your time when you're probably very tired, but you're still doing this. So it's much, much appreciated. And I know it's helping a lot of people. Another thing, just can you share kind of a typical work week for you? What scope of procedures do they have you doing? And I think you just kind of told us your schedule. It's Monday to Thursday and then a half day Friday. But do you start at 7 or 8? What time do you guys usually wrap up?
Yeah, so we start at 8 on most days. We wrap up around 6. And yeah, on a typical day, on an average, I think I'm seeing around 20 patients. Some days it goes up to 25, other days it's like maybe 15. I have a production column, so one production column, two new patient columns, and then an overflow column, and then some hygiene checks. That's the hygiene column. So pretty much the production column, I would say, um, on an average, we try to keep 1 hour per procedure. So so that's like an for most of the patients. For some patients, if, for example, if I'm doing a root canal or something like that, where I would need a little bit longer, it would be maybe a 2 hour slot for one patient. New patients, our office is probably seeing on an average 7 to 8 new patients per day. So those definitely take up a lot of time. So those are side books. So you have to learn how to cut between procedures and go see those new patients. So that was something that took a little time, but I'm getting there. I still feel like I spend too much time with the new patients and kind of get backlogged with my procedures on some days. But I also feel like new patients are the most important at any practice. Like you have to give them all your time, all your attention. They are the most important, I feel, during your workday. And then overflow is more for me, it's more denture steps, more, sometimes crown seats are also in the overflow. The whatever the assistants can help with a little bit, we have that in the overflow.
So tell me a little bit more about your new patient appointments. How long are they typically? Is the assistant or a hygienist kind of leading things and then you come in, or do you pretty much start to finish? Are you with the patient? How does it work?
Yeah, so the new patient, we typically tell them that they are going to be there for around an hour to a little bit more than that even. So when they come, the first thing is taking their x-rays. The dental assistants do that. Once they're done, the hygienist goes in. They do their perio, charting and everything. After that, I go in, I look at everything, talk to the patient. So typically, I would say, yeah, like I said, around an hour by the time you're done. Once I am done, I kind of hand over to to my office manager. She comes in and then she takes the patient to the consult room where she goes over the entire treatment that was planned. And, if needed, they break down treatment sometimes, depending on how the patient's doing, what their, goals are. So it's a pretty sequential way. And then we try to give each person who goes in before you and kind of tries to give information to the other person to make the process more efficient.
Yeah, that sounds really nice. And do you feel like in your way that your practice runs, are you often discussing the dollars with patients and talking about insurance and things, or is it more directed towards the office manager and she kind of handles all of it?
Yeah, I feel like I don't talk much about that. A lot of patients, once I, let's say I do their exam, and once I tell them that this is what's going on, this is what I want for them, a lot of times the next question is that, I like your plan, but how much is all of this going to cost? And I'm like, for that, you're going to be meeting my office manager. She's great. She's going to go over what's probably going to work for you if we have something that, some payment plans, things like that. So kind of directed towards them. And I just feel like they're better at that. So they should take care of it. Yeah.
Couple more questions before we wrap up. I know we're probably taking a little bit longer than expected, but I'm just enjoying so much hearing your experience. And I talked to another one of our classmates last week, and it's just fun to see like what everyone's doing and kind of compare and contrast like other structures to kind of how my office works. But as a lead doctor, again, you mentioned like there's an owner that sometimes you can collaborate with if you want to like run a case by them or something, but really you're like the main person there and you're the main dentist. So how do you personally kind of set your own goals, set your own benchmarks, make your own focuses when no one's really telling you kind of what to do and giving you a lot of guidance?
Right. So I feel like once you're going to start working after school, you are going to start looking at a few things like production numbers. You're going to start looking at, where, just like your speed, things like that. So I feel like I've been setting some personal goals. I know I kind of talk to people. I get to know the average, like, this is the average production that one should have once you get out of school. This is what you should build up to. So a little bit of that, keeping a track of what mine is, and just trying to improve every day. That's pretty much what I've been trying to do on a day-to-day basis. I love trying new procedures. It's not the best thing to do because I feel like sometimes I challenge myself too much, and I'm like, this should have been referred out. But yeah, that's another thing. So that just kind of exposes me to a lot of things that I've not done earlier, while I know that I have someone to back me up if I'm stuck, if I have a question. So just being a little bit of a risk taker, I think goes a long way. It's not always, but a little bit of a balance between that and obviously knowing when to ask for help, when to refer.
I talk about that a lot when it comes to like advice for associates. It is such a balance of being confident, working independently, pushing yourself through a situation before you ask for help and things, but then also obviously knowing like this is hard and then that one's too hard. So I should probably start with hard first before I start with like too hard. Maybe refer that other one for now. It's definitely a balance, but that's how you grow, is by pushing yourself. So I love to hear that you're doing that as well. So kind of our last thing, I just like to leave people with the opportunity to give any kind of closing thoughts or just final advice for people listening in, probably in this case, some international dentists, some dental students, maybe some fresh associates, anything that you'd like to share with them?
Yeah, so for international students, my one big advice would be just be strong. You've chosen this path. It's going to take time, but you're going to get in. Like, you are going to get into school. Just don't give up. Be resilient. That's my number one advice for all of you. For students, I would say while you're in school, you should take every opportunity you can to just make the most out of your time. I still remember whenever we would have a free time at school, I used to see a lot of my friends and even me sometimes. We would just go to specialty clinics like periodontics or pros or surgery and just try to see specialists do stuff. That way you learn so much. So while you're in dental school, you can learn so much, just kind of expose yourself to so much that when you do come into practice, you're going to see that you're going to be so much better at like treatment planning and diagnosing and things like that. For associates, I would say associates and someone who might be in a similar position as me, lead dentist. One advice would be treatment planning. I feel like that's a very, very important skill to learn. I feel like I see so many new patients. I still feel like I'm learning. It's hard to make them trust you in such a short period of time. You have 10 to 15 minutes with that new patient to make them, trust you and believe in you. And then if you are able to convey what you want for them, you're changing their life. You're doing something for them. So think about it in that way, that if you are good at treatment presentation and, basically getting patients to accept your treatment, you're helping them, you're just helping them get better care, improve their lives for the better. So very important to just learn that skill. And then this is just a last thing that I've been learning from my own experience. So if anyone ever steps into a lead dentist position, remember that patients obviously come first. However, when you have a team who's looking up to you as a dentist, you have to take care of your team. I think I learned that a little bit later. For me, my focus was always that patients are the most important people. When you go to work, you're doing everything for them. But I feel like your team, your DAs, your office manager, your receptionist, all of them are equally important. And just taking care of them, keeping them happy, all of that is going to take you closer towards your goal. So even if your goal is, and getting better care for the patients, keeping your team happy and oriented, and it's just going to help you reach that goal faster.
I love all of that. And again, thank you so much for coming on here today and sharing your experience, your positivity. I think everyone's going to leave this episode feeling motivated and happy. So I really appreciate you sharing your journey with us.